Hello everyone, this is Yoshiko Yamaguchi from Kwassui Women's University, Japan. I am so pleased to have an opportunity to present a part of our research in this international conference in webinar. So, I work at Faculty of Nursing, Kwassui Women's University in Japan. I have been teaching and researching about nursing, especially nurse retention, relating stress with their work and family. So today I will talk about a part of my research, nurses' work and family-related stress level, comparing with among nurses. In this study, we focus on difference of nurses' workplace, hospital, and internal, and district, external. Nurses are predominant healthcare workers in the world and dedicated to the robust role of maintaining or promoting people's health. So nurses are important occupation to keep people's health status. Therefore, nurses are also required to maintain good health status themselves for fulfilling good performance. However, regrettably, so several studies reported that nurses' poor mental health status. So then we are wanting to explore how their health status, especially mental health status, could be improved. Nurses are characterized by the fact that women predominant workforce. Still now, women are often delegated major family tasks more than men. So we suppose that many of nurses might feel stress with relating their work and family life. Then this stress may affect their mental health status, and this would prompt their intention to leave work nursing. Both work and family life are our foundation and necessary things. Most of the time, other than sleeping time, we spend in work or with family. For us, work and family life affect each other. For example, when we fail something in work, then feel depressed. After go home, we feeling not good, then wouldn't want to do family obligation. For example, cook or cleaning. So however contrary, if we success delegated project, we are very happy, then we can enjoy to do family tasks after go home. Also, opposite direction exists when we spend happy time having good relation with partner or children, so having good event which their children awarded in a class for something. So we feel happy, then we can go to work, then we will be able to good performance in work more than we are normal feeling time. Regarding work and family life interaction, negative direction representative concept is work-family conflict. Work-family conflict is perception of difficulty arises from competing responsibilities to work and family. Individuals who are active in both work and family domains experience conflict about the distribution of time and energy for performing each task, which is defined as work-family conflict. Therefore, this perception has negative effect to employees' psychological consequence variables turnover intention as well, and mental health impede. On the other hand, positive direction representative concept is work-family enrichment. Work-family enrichment, which occurs when an individual takes the resource created in one domain and transfer them to the other domain, creating a better environment in both domains. It seems like integrate both work and family life. Therefore, this perception have positive effect to employees' psychological consequence variables, well-being, good mental health status, and reduce turnover intention. In past study, negative side of work-family interface, concept of work-family conflict, its antecedent or consequence was focused. However, recently, this positive perception work-family enrichment have been focused by researchers. Both work-family conflict and enrichment are predicted by work-family related variables. Negative perception work-family conflict is predicted by negative work-family stress. High job demand relate high work-family conflict. Also, high family law stress associate high work-family conflict. Contrary work-family conflict, work-family enrichment is positive perception of work-family relation. So this is predicted by positive work-family related variables. High work engagement predict one's high work-family enrichment, and also high family support associate to high work-family enrichment. Then these two work-family perception have opposite impact to work or family status. Negative perception, work-family conflict have negative impact. So if someone's work-family conflict high, then if it continue, he or her mental health status impede, finally decide leaving work. On the other hand, positive perception, work-family enrichment have positive influence. If someone feels work-family enrichment, if it continue, he or her job or family satisfaction high, then they feel happy in both domains. These two work-family related perceptions are predicted by work environment, so we suppose even if same occupation, for example nurse, in this study, their level of work-family conflict and enrichment would be varied depends on their workplace environment. Nowadays, nurses who are keeping and maintaining one's health work variety place. Nevertheless, still now, representative nurses workplace is hospital. In Japan, around 65% nurses work at hospital. As you know, hospital nurses care for the patient who stay in hospital. It is internal nursing. District nurse, they work outside of hospital. District nurse visit the resident who need care in their own home or care residence, then care for them. It is external nursing. Recently, average patient hospitalization duration is decreasing in Japan due to the government policy. Therefore, need for care patient in their living environment is increasing. By this situation, the number of district nurses have been increasing now. In previous study, it was reported that district nurses showed high job control because most of the time they visit their patient in their home by alone. They are allowed decision-making authority by their work environment. Thus, we suppose that even if same occupation, the level of work and family-related stress level would be varied in between hospital and district nurse. Along the mentioning background, we generated the following study purpose. The purpose of this study is to explore nurses' work and family-related stress level with comparing between hospital nurses and district nurses. Data were collected in the Kyushu in Japan. Regarding nurses' data, we randomly selected hospital and home healthcare institutions in Kyushu, then asked them to give the permission conducting the study. Finally, 4 hospitals and 34 home healthcare institutions have agreed to attend our study. We analyzed total 488 valid questionnaires. We measured the 3 groups study variables, which were the negative direction, positive direction, and stress outcome. Regarding work and family stress variables, negative aspect, we measured target work-family conflict, work or family load overload with using varied scale. Measuring target work-family conflict by using Japanese version of the multi-dimensional work-family conflict scale. The original work-family conflict scale is in English Dr. Watai has translated then validated this English scale to Japanese version. Target both work or family load overload were measured by using abbreviated work and family overload measures, which are created by Dr. Russell Matthew. This scale originally in English, so we translated this scale to Japanese after we gained permission from Dr. Matthew. Next is positive direction. We measure target, work-family enrichment, work engagement, and work-family culture. Measuring target work-family enrichment by using shortened work-family enrichment scale, which is created by Dr. Kirkman. This scale originally in English, so we translated this scale to Japanese after we gained permission from Dr. Kirkman. Target work engagement was measured by applying Japanese version of Utrecht Work Engagement Scale short version, which created by Dr. Simmons. Regarding target work-family culture, we measure the level of belief that the participant organization understood his or her family law. We created one item, your organization understand your family law. Response used a 4-point scale. 1 is there is no understand, 4 is there is understanding. As outcome variables, we selected to measure and target intention to leave work and overall subjective health. We applied independent t-tests to compare hospital nurses and district nurses for their positive or negative work-family related stress variables and its outcome. Next is result. The average age was 36.2 years for hospital nurses and 48.2 years for district nurses, respectively. In negative aspect, hospital nurses showed significantly higher level of work interference with family. This is a part of work-family conflict and workload overload than district nurses. In positive aspect, district nurses scored significantly higher level of all positive stress direction variables than hospital nurses. Next is outcome variables. Hospital nurses indicated significantly higher score of intention to leave work than district nurses. There are no significant differences exist for overall subjective health score. Implication for practice. Ahead of it, this study have limitation of sample size inequality. Hospital nurses sample was much bigger than district nurses. This due to institution size because each home healthcare institution have only around 3 to 10 nurses. Compared collecting data from hospital nurses, gathering data from home healthcare nurses are much more difficult. However, this study result indicated that hospital nurses' stress status might be worse than district nurse. Therefore, it is implied that hospital nurses' work environment would be severe. This study results also give insight for strategy improving hospital nurses' work environment. If hospital nurses are able to work as like district nurse, for example, work more independently in the hospital, have more decision-making authority, this would make hospital nurses' stress status be better. Thank you for your kind attention. Thank you very much.